It's my pleasure to be with you in this nice program about health issues in Ramadan and fasting. And I presume this is a very essential program because the questions in the mind of pregnant ladies are many, and they need some guidance and advices regarding such a very sensitive issues, because religious aspects should be respected, and meanwhile also we have to know about what is the rules for our health, what should be done and what should be avoided, without feeling guilty that we are not obeying religious rules, and meanwhile without doing any hazardous aspects regarding our health. So I think that pregnancy is one of the very common events in the life of every lady. I mean, in her life, she's pregnant at the time of her life. And if this coincides with the month of Ramadan and fasting, so many of them ask, what about if I have some health problem? Should I go and fast or not? Well, one of the very common, or it's not a very common, but one of the common things during pregnancy is diabetes with pregnancy. And those to know what's diabetes, diabetes means a high blood sugar above the normal limits accepted for healthy people. We usually do some investigations to diagnose these conditions by measuring the blood sugar during the fasting state, and then we allow the ladies or the subject to eat some carbohydrate or to drink some sugary or sweet juice, and then we do another estimation of the blood sugar after 2 hours, and by measuring these two parameters we can diagnose if the pregnant ladies has diabetes or not. And one of the essential investigations in early pregnancy for all pregnant ladies, we measure the hemoglobin to know if they have anemia or not, and the second thing we do blood sugar estimation, as I mentioned, fasting and 2 hours after meals. So by coincidence, by chance, we pick up some ladies, some pregnants who have the problem of diabetes. They have elevated blood sugar, and there are some suspicious who guide us to diagnose the diabetes to those who have a family history, for example her mother or her father or one of her relatives have diabetes, or some warning symptoms and signs that let us do this test in particular and put the diagnosis of diabetes with pregnancy. Well, what happens if a pregnant lady has diabetes, or a woman who knows to be diabetic and she got pregnant? What usually happens in these cases? First of all, we have to know what treatment she is using. We have two big categories of diabetic drugs, or we call them oral hypoglycemic. Hypoglycemic means which reduce the blood sugar. We have the oral hypoglycemic group, and other patients receive injections, the famous insulin injection. So there are two lines of treatment, the oral tablets and the injection, the shots she received in the form of insulin, and both of them work to reduce the blood sugar to the normal level, and by this we avoid all the complication which happens from the high blood glucose. So first thing, and the very important things to be done, that all oral hypoglycemic should be stopped as soon as pregnancy is diagnosed. Any doctor knows about this fact, but not all patients or not all ladies know about it. So she has to consult her doctor immediately once she presumed pregnant, and to ask him how to shift from the oral hypoglycemic, because it's well known that oral hypoglycemic might have a teratogenic effect on the fetus during pregnancy. And teratogenic effect means that it might cause some damage to the fetal tissues, resulting in malformations, deformities, or congenital anomalies of the baby, things that we don't like to meet or we don't like to see in our cases. So we have to stop oral hypoglycemic, and all pregnant ladies, the shift to insulin injections. And concerning the insulin injections, there's so many insulin in the market, so many brands for different companies, but they all share a common thing, that they're either a long-acting insulin or a short-acting insulin or intermediate-acting. What does it mean, this? A short-acting, it means when you receive the shot of insulin, it will regulate blood sugar for a short period of time. For example, you take it in the morning until the afternoon snack, you have a good and excellent blood sugar, but after this, the effect of insulin is fading out, and then the blood sugar will rise again. This is a short-acting. The long-acting, it means that the duration of the effect of the drug is sustained for a long period of time, maybe for the full day or half day. This is the long acting. So what we choose for the pregnant ladies, usually we prefer to use a combination of these two drugs. In the morning we start with the short acting, and then we give the long acting to have a sustained effect till the afternoon and throughout the night till the next day. And actually it's not an easy task. It's a difficult job for the doctor, that he has to titrate the dose of the insulin according to the blood sugar of the patient. Something like cooking. When you cook a food, you put a little of salt and you taste. You see this is enough or not. Sometimes you have to add more until you reach the optimum dosage required to control the blood sugar. So this actually needs a sum of trials on and off to increase and decrease until we reach a formula which is excellent and compatible to this blood sugar of these pregnant ladies. Up till now, I didn't touch the issue in the mind of all pregnant ladies, should I fast or not? Definitely, it goes without saying, and without feel of any guilt, you should not fast during Ramadan. You have a license from the God, and in all religions, it's a license from God that the pregnant and lactating, if they have a medical problem, they are licensed to not to fast. So I advise and I recommend, and I strongly recommend for those diabetics not to fast. For another reason also, not only because they need medication on a frequent interval, but because those diabetic patients, they have to eat on a very short intervals. We cannot ask her to fast for a long time, because this is have a very hazardous and deleterious effect on the metabolism of her body. In those cases, to make it more short and easy to understand, those diabetics, if they didn't eat, so the body start to burn the fat. Usually the first thing in metabolism, we burn the carbohydrate, the sugars to take energy. When the body does not find sugar, it will start to burn fat. And the degradation products of this fat in the form of lactic acid and so many acids, this have a very hazardous effect on the metabolism and on the blood, and this leads to accumulation of acids in the blood and results in what we call acidemia and ketonemia and so many problems and complications because of not eating for a long time in the diabetics. So we have to ask her to eat on a short interval every 2 or 3 hours, and we have to give her this insulin on an intervals also. So I think it's impossible and absolutely not accepted to fast in this situation. I think the real problem in those ladies is a psychological feeling that they are doing something wrong when they don't fast. They feel guilty, they think that God will not bless them, or they feel shy and ashamed from the surrounding. Everybody in the house is not eating and fasting, and she feels shy to eat among those people. I don't think that this should happen. They should feel comfortable, and they should feel that they're not doing anything wrong. Okay, and I also give recommendations for the family, the surrounding in the house. They have to support the diabetic patient, whether pregnant or not. They have to give them the moral support, not let them feel guilty that they are eating, okay, and arrange the circumstances in the house that make everybody feel comfortable. And I think that in the Sharia and in the fiqh, in that cases, when she fasts, she can give money to those who need it, or she can give food to those who need it, instead of not fasting in Ramadan. And I wish them the best of luck and best of health. Enjoy Ramadan, enjoy your time, and have a safe pregnancy, and good luck for all of you. Thank you very much.